Welcome to our mnemonic video on chest pain differential. Let's get started. Two households, both alike in grief in this fair morgue, is where we lay our scene. This is the city of Verona's morgue, where we will bear witness to an autopsy being done right before our eyes. Sitting on the floor of the morgue room, we see a man clutching his chest with a torn heart overwhelmed by grief. He looks like he wears the colors of the Capulets, or is it the Montagues? In any case, he's here to find out how his dear friends Juliet, Romeo, and Mercutio have met their untimely death and to remind us of chest pain. To the left of this scene, who else do we see but William Shakespeare himself? Maybe he appears taller and skinnier than the history books describe, but there's no doubt it's him. Shakespeare is also here to find the cause of his friend's death. And unlike our grief-stricken friend on the right, he lit a cigarette and is now pacing the room back and forth as he got dressed. Next to him is an old air-filled bird cage in the shape of a thorax, our symbol for pneumothorax, another differential of chest pain. Pneumothorax occurs when air gets into the pleural space of the lung, causing increased pressure, which starts to collapse the lung. It can be caused by trauma like a broken rib or stab wound puncturing the pleura of the lung, or spontaneously, which often occurs in tall, skinny males, like Shakespeare's body habitus as we've shown here. And this is due to the thin-walled blebs under the pleura at the top of the lungs. Also, let Shakespeare's lit cigarette remind you that smoking can predispose someone to have a spontaneous pneumothorax. Now, what is that Shakespeare is holding in his hand? He has picked up an anatomical model of a heart and is staring at it sadly, contemplating the meaning of life and death. At least, we hope it's a model. This is a morgue after all. Anyways, this bruised, battered-looking heart with black and blue streaks is our symbol for acute coronary syndrome, which should also be on our differential for chest pain. Now let's look at the stools next to him that he has kicked over in frustration as well. These three stools are tall, short, and inverted. They represent ST segment elevation, ST segment depression, and inverted T waves on an EKG respectively. These should remind you of the EKG changes seen in acute coronary syndrome. All in all, it seems like Shakespeare is going through a lot of heartache today. He wonders aloud to the heart he's holding if he should write down his thoughts in a book somewhere and turns his experiences into a magnificent play. The cigarette and roaming around weren't enough. He snorted some cocaine hoping to get through this sad day. He's got that cocaine from his necklace vial that he saves for such hard times. Anyway, this idea here should remind you that cocaine use can cause severe chest pain up to myocardial infarction due to the potent sympathomimetic effect of cocaine, which can induce potent coronary vasospasm, increased heart rate, and elevated blood pressure. However, Shakespeare seems okay, and he keeps thinking in silence about the heart he's holding and if he should write down his thoughts in a book somewhere. Let's let him ponder this and move on to see what happens next. If we look to the right corner of our scene, here is a clue for why exactly our grieving character appears so overwhelmed. The morgue is quite busy today with autopsies, and they have placed this corpse in a tank of water directly in front of this poor crying fellow to await his turn to be dissected. Notice the way this water surrounds and compresses the corpse. This idea should remind you of cardiac tamponade, a condition where fluid accumulates in the pericardial space, compressing the heart. Cardiac tamponade can be identified clinically by a set of symptoms called Beck's triad, which consists of hypotension, elevated jugular venous pressure, and distant heart sounds. Cardiac tamponade is another one of our differentials for chest pain. Now let's meet the man of the hour, the coroner. In the center of the room, we can see the coroner lighting candles to provide more light as he investigates these suspicious and high-profile deaths. As he lights them, the wicks sputter and send off smoke as they burst into flame, making the coroner cough. The heat from the candles combined with his heavy cloak is also making him sweat. Anyway, the cough, sweat, and coroner struggling to breathe through the smoke should remind you of the cough, fever, and dyspnea seen in pneumonia, another cause of chest pain. We've been in the morgue for a while, but we haven't seen any autopsies. So let's introduce this. That's the body of poor Mercutio, who, as we can see, has been stabbed to death. This idea here should remind you of esophageal rupture, a full thickness tear of the esophageal wall, as depicted by this knife lodged in the esophagus here. Also, let the knife position remind you that iatrogenic rupture is most common and is seen in the cervical part of the esophagus. Although the cause of death is obvious, the coroner was suspicious about that vomit around Mercutio's mouth. So he didn't want to miss any evidence at the crime scene and brought this wine bottle as evidence, since, after all, Mercutio is an avid drinker. Anyway, this should remind you of alcohol intoxication, a common cause of vomiting, which can also lead to esophageal rupture when forcefully repeated, leading to Boerhaave syndrome. Here we can see the body of Juliet dissected along the chest and abdomen. The dissection of Juliet's chest reveals her main cause of death. We see a knife lodged in her chest, more specifically at the branching of the pulmonary arteries. That's creating a blockage of blood flow to the lungs. This blockage of blood flow to the lungs should remind you of a pulmonary embolism, another differential diagnosis of chest pain. Now let's take a look at the lower part of Juliet's dissection. The coroner has really dug deep to find out the cause of her death. Unlike Mercutio's autopsy, Juliet's dissection extends down into the small intestinal area as well. The coroner was searching very intently for traces of poison in her stomach and guts, but there was no poison to be found, and he has left her intestines laying out on the examination table with blood still spurting everywhere. Overall, this is a very chaotic dissection. And remember, chaotic dissection sounds like aortic dissection, which should remind you that aortic dissection should be on our differential diagnosis for chest pain. Next, let's take a look at Romeo's autopsy. To the right is Romeo's corpse. Unlike the other two, it looks like the coroner has only dissected as far as his chest muscles. It was as far as he needed to go to come to a conclusion. The muscles all appear ragged and torn, and the area around his chest wall appears black and blue, as if it's bruised. The coroner here is an expert in his field, and he knows that these damaged chest wall muscles are just a sign of musculoskeletal issues. The more he dissects, the more damaged looking the area seems. And this idea should remind you that musculoskeletal issues can be a cause of chest pain as well. Now let's see how the coroner has been disposing of the bodies. In the right back corner of the morgue, we can see an old furnace burning. This furnace is also being used as an incinerator, and we can see the heart of a previous corpse tossed inside to be burned away. The flames should remind you of inflammation, and this heart surrounded by flames should remind you of pericarditis, which is inflammation of the outer layer of the heart. So flames around a heart for pericarditis, another cause of chest pain that should be on our differential diagnosis. That's not the only furnace in the room, however. Remember when we said that this morgue gets quite busy? Let's take a look at the next incinerator. This second furnace is a little fancier and has a heart-shaped hearth. You can see the flames on the inside of the heart. Remember, flames are a recurring symbol for inflammation, and the flames inside the heart should remind you of endocarditis, which again is another cause of chest pain. Now let's look more closely at the chimney. The red brick of the chimney leading down into this furnace should remind you of an esophagus leading into the stomach. And the fire below should remind you of heartburn, a common symptom of GERD and a common cause of chest pain. We can also see that the flames from the fire below have charred and blackened the bottom of the chimney. And this should remind you of how GERD damages the lower portion of the esophagus with the risk of developing metaplasia and eventually cancer if the reflux is severe or chronic. It looks like the coroner has done all of the investigation he needs to determine that the cause of Mercutio, Juliet, and Romeo's death was foul play. All right, and with that, you've learned everything you need to know about the differential diagnosis for chest pain.